It doesn't get quite as much press as the heart and the brain, but the liver is one of the most important organs in the body, and when it fails, it causes many complications, including bleeding, infections, confusion, coma, and ultimately death. For many types of liver disease, once they're severe enough, the only treatment is a liver transplant. Before we go too far, I want to thank Good Cell for sponsoring this video, but more on that later. So how does one go about getting a liver transplant? If we were able to grow livers in a lab, the process would be very straightforward, but since currently the primary way we get livers to transplant into sick people is from deceased donors, meaning people who die and are listed as organ donors, the process becomes a lot more complicated. And that's because livers are scarce. There are nowhere near enough to go around, so we have to find a way to safely allocate them to everyone who needs them, or at least as many people as possible. We need a score to determine how sick your liver is. So we developed one called the MELD sodium, Model for End-Stage Liver Disease Sodium. And that uses blood test values that typically worsen as your liver disease worsens. Your creatinine, your bilirubin, your INR, and your sodium. We first use this score to determine whether you even need a liver transplant in the first place. See, a liver transplant is a high-risk surgery, and following the transplant, you have to be on immune suppressants to prevent rejection, which makes you at much higher risk of getting severe infections. So if your liver is only a little bit sick, the risk of getting a transplant is actually higher than the benefit. Once your MELD score is high enough, a liver doctor can refer you for transplant. And that doesn't mean that you can get a transplant that day. Far from it. Remember that safe, healthy, transplantable livers are very scarce. This means we need to be very strict about who receives them. We need to make sure you're healthy enough to get one. If you already have severe heart disease or lung disease, your body may not be strong enough to survive the transplant surgery. If you have untreated colon cancer or breast cancer, then even with a successful liver transplant, you potentially wouldn't live very long. It sounds a bit grim, but we need in part to allocate organs based on who can get the most use out of them. So prior to even getting on the transplant list, we need to do a bunch of tests to make sure that you're even healthy enough from a non-liver perspective to survive the transplant surgery and have the best chance of surviving post-surgery. So what does that mean? You're going to need an echo of your heart, a colonoscopy, a mammogram, maybe an x-ray and a CT scan of your lungs, a ton of blood work to make sure that you don't have underlying infections that could worsen after suppressing your immune system. This is also why transplant centers require vaccinations and why they're starting to require the COVID vaccine. We need to make sure that you have the highest chance of surviving infections that you may get after transplant once you're immune compromised. Then we need to be able to make sure that you can take care of your liver. You need social support with caregivers to bring you to appointments and help you with medicines after the transplant. If alcohol contributed to your liver disease, you need to demonstrate some level of current sobriety and undergo relapse prevention counseling. Before we go further, I want to take a minute to thank our sponsor for this video, Good Cell. Good Cell is a life sciences company that offers a proactive, preventative healthcare service with personal biobanking. What is personal biobanking? It's the storage of your own healthy cells for future potential cellular therapy. You've probably heard of a bone marrow transplant before. In some cases, a bone marrow transplant can be done with a patient's own healthy cells. The idea behind Good Cell is similar and potentially much more powerful. Through a simple blood draw, just like one you might get from your doctor, you can save your own cells for the possibility of using them in the future to cure diseases you don't even have yet. At first glance, this might sound a bit like science fiction, but Good Cell recognizes the current exponential increase in cell therapy trials. Literally hundreds of clinical trials are underway looking at how to use something called induced pluripotent stem cells, or iPSCs, to treat a wide range of diseases, from macular degeneration to Parkinson's disease to heart disease. Now, these special cells can be made from your basic cells in your blood, so a simple blood draw is enough to prepare you for the future. Good Cell has a streamlined process to store your cells indefinitely and then provide them to your doctor in the future if they're needed. A similar process is currently done using saved cord blood and extracted bone marrow, but Good Cell makes this process accessible to anyone without the need for a painful extraction procedure. To learn more and consider signing up, check out the link in the description. Now back to liver transplants. After you go through all of this testing, you go through a review by a large committee of social workers, liver doctors, transplant surgeons, and more, and then if you're approved, you can be listed for a transplant. So does that mean you get a transplant that day? Usually no. Like I said earlier, livers are scarce, so you join a big list of people waiting for a transplant. So what determines the order of this list? It's not first come, first served. So even if you've been waiting for a month on this list, it's possible that someone who's only been on the list 2 days could get a liver before you. Why is that? Because the order of the list is driven by that MELD sodium score we talked about earlier. The sicker your liver is, the higher your MELD score, and the higher you will be on the transplant list. There are plenty of different exceptions or unique cases that can increase your position on the list, but in general, the MELD score is the most important metric. When a liver in your geographic region becomes available, once confirming that it's a healthy, viable liver, the liver will go to the person with the highest MELD score and matching blood type in that area. That person is then rushed to the OR, and then 8 to 12 hours later, they'll have a brand new liver and a cure to their liver disease. After getting a transplant, you undergo a recovery period in the ICU, and then you'll be started on those immune-suppressing medications to keep the liver from being rejected. With time, after many years, some patients can actually come completely off of those immunosuppressants, but most people stay on a low dose for the rest of their life. Like I said, liver transplants can be completely curative for some genetic diseases and for those, for example, with alcoholic liver disease, as long as they remain abstinent from alcohol. The list of conditions that require a transplant is long, and some of those, unfortunately, are not permanently cured by a liver transplant. So having more than one liver transplant is not unheard of. The procedure has risks, as do the immune-suppressing medications you take afterwards, but overall, many people can live for decades with a liver transplant in many cases. If you have any additional questions about the process, please feel free to ask me in the comments. Thank you again to Good Cell for sponsoring this video. You can check them out at the link in the description. Have a great day, and thank you for watching.